Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Thursday, December 16, 2021, believe it or not. I find it hard to believe that we are this far already through December. But thank you so much for joining us. As always, this is your opportunity to get your COVID questions answered. You can put questions directly into the box below or use the hashtag AskDrArwady on either Facebook or Twitter. We had a lot of questions come in on Tuesday, and so I've put together some slides to help address some of the ones we didn't get to Tuesday, but we will work to take a lot of your questions live. As you can see, really pleased to have a guest with us today. This is Jennifer Vitus. She is the Chief Program Officer at the Chicago Department of Public Health, one of our deputy commissioners, and among other things, she oversees our Maternal, Infant, Child, and Adolescent Health Bureau. You all write in a lot with questions about what's happening with moms and kids, and so I thought it was a good opportunity to have Jen come on and talk a little bit about that. We'll have a little bit of a focus today. I'll do some about pregnant people and COVID, but also a little more broadly about the work of that bureau. So welcome. Tell folks just a little bit high level about what you do so they know what kind of questions to ask, and then we'll dive right in.
Sure. Thanks, Dr. Arwady, for having me. As Dr. already mentioned, I'm supporting the work that our team, our amazing team at the Chicago Department of Public Health, and many, many partners in the community are doing to improve the health outcomes of moms and people who give birth, of babies, children, school-age children, and adolescents. So lots of work to be done in that area. We're really excited. I'm excited to be here, share more about what we're doing, and take your questions.
Great. So you can start putting them in, but as always, we will start with our COVID data dashboard. chi.gov/COVID- is how you can get there directly. These are City of Chicago numbers. Let's pull it up. So what you can see is that we are very much in a Delta surge. And I want to be clear that this remains a Delta surge. More than 99% of our cases still here are Delta, although Omicron is on the increase across the U.S. We are averaging 969 new COVID diagnoses just in Chicago residents every day. And that may not even include people who are doing home tests and not necessarily having those reported or confirmed. This is a lot of cases. It's why all of you, just like me, are probably hearing more and more about people with COVID in your personal and professional lives. So still, after that post-holiday surge, have maintained this high level of COVID. Hospitalizations also up. We've been seeing this day after day. We are right now averaging 61 new Chicagoans being hospitalized with COVID-19 every day. I just want to be clear, that is a daily average. That was a question that we were getting. When we say 60 the prior week, that means over, a week ago, we were averaging 60 new admissions every day in the prior week, not 60 over the week. And that is also, as you can see here, very much increasing. It's really the highest that we've been. If we look here, that's the highest that we've been since the surge last winter in terms of hospitalizations for COVID. It has beat out our Alpha surge, it has beat out our earlier Delta surge, and we are still on the increase. Similarly, deaths are back to a higher rate. We are averaging between 7 and 8 new deaths every day from COVID in Chicago residents right now. That's higher than we have seen in months. You can see we were averaging between 4 and 5 a day in the prior week. A lot of you have been asking about vaccinated, unvaccinated. I will refer you on Tuesday. We shared a lot of data. Those slides are posted online comparing the different rates of cases, hospitalizations, and deaths in Chicago residents between vaccinated and unvaccinated. And absolutely, the huge majority of people both being hospitalized and dying from COVID in Chicago right now are people who are not vaccinated. 98% of all of the deaths in Chicago, the COVID deaths, have been in people who are not vaccinated. And if you look at, there's concerns about breakthroughs, et cetera, still, we shared on Tuesday, 99.997%, more than 99.99% of people who have been vaccinated against COVID have not died from COVID-19. We've had 0 deaths in the city of Chicago as a direct result of receiving the COVID vaccine. You see our vaccination numbers are doing pretty well, 14,000 a day. I'd like to see that even higher. We'd like to see boosters coming up. Yesterday, we celebrated the 1-year anniversary of vaccinating here in Chicago. We had a really nice press conference highlighting regular Chicagoans who have been doing the work of not just getting themselves and their families vaccinated, but reaching out to folks on their blocks, in their community groups, and really thanks to everybody who has gotten us this far. But I remain very worried about the hundreds of thousands of Chicagoans who still are not vaccinated. We are testing a lot, 27,000 every day, formal tests. And in that setting, our positivity has remained pretty good at 4.4%, certainly up. But we know we are continuing to test a lot, which is good. I want to just show you one more piece of data here, because a lot of the questions or comments that I was getting in on Tuesday were really not believing some of the data that I was sharing. So just to give you a sense, Steve Green on Facebook said nobody under the age of 80 is dying from COVID. And I want to remind you how you can look up Chicago data specifically on questions like that. So let's just talk through that again. If we go to cases here on the top, this is where you can look and see throughout the whole pandemic, or you can choose any time frame you want, what is happening with cases, hospitalizations, or deaths. You can break that down by age, gender, or race ethnicity. You can also look and see what's happening by zip code, et cetera, but just at the most basic level. So let's take Steve Green's comment here, where he doesn't think anybody under the age of 80 is dying. Boy, do I wish that were true, but it is not true. So we're going to go to deaths here, and this will tell you everything that has happened with COVID deaths in Chicago. Again, it defaults that right now we're averaging between 7 and 8 a day, but if we go to cumulative totals, for example, and I say over here, let's look at it by age. We click, and right away you can see throughout the whole pandemic, we've had 6,317 Chicagoans die from COVID-19. 2,001 of those were in people over 80, but all the rest, more than 4,100 have been in people under 80. And you can see going down here, there have been, for example, 747 people in their 50s who have died from COVID, et cetera. So I just ask, I'm glad when people raise these things, but I want you to know where you can get the local data, because I want you, the things that we share are the truth about what is happening with COVID in the city. So with that, let's turn to a few of the slides. I'm going to do a few COVID updates, and then Jen, I'm going to have you talk a little bit about the maternal, infant, child, adolescent health work. Again, a lot of these are pulled together specifically to answer the questions that came in on Tuesday. Let me just get into the slideshow mode. Okay, so first of all, where are we? Where do these numbers, what do they look like in terms of our risk level? That case level is in that very high transmission category, and that's where we've been. Continue to see cases on the increase. The good news, as much as there is good news, is that different from before the vaccine was available, we do see some separation there between cases and then hospitalizations and deaths and ICU, because the vaccine has done such a good job of protecting people from serious outcomes. So even while our case count is in the very high transmission and rising, both our non-ICU and ICU beds are still in that substantial transmission range. Now, I don't like them in substantial, particularly as they're increasing, but that is different from before vaccine was available. And then with more testing capability, our test positivity has remained in that lower range risk. Just quickly highlighting again, the very high case rate is continuing after the post-Thanksgiving surge in cases and diagnoses. On the right in the red circle is where you see what's been happening. And right there on the graph is why you are hearing more about COVID cases, probably in your own personal life in Chicago. The test positivity, you can see, has now exceeded anything that we saw over the summer and continues to increase. we don't have a different message here. Vax up, mask up, back up, wash up, and test up. But in order of importance there, vax up is the most important among them. And testing, I think, is increasingly important, especially as we're thinking about holiday gatherings. If there are folks who are not vaccinated or boosted, or even if there's going to be a large gathering of people, there have been exposures, doing additional testing is important in terms of limiting risk. So lots of questions about boosters. Donna Tritz, Nunes Babsy, others were writing in with lots of booster questions. So I wanted to just remind you, who's eligible, when should I get it, which one? Anybody who got a Pfizer vaccine and is 16 or older can get a booster 6 months or more after their initial series. Anyone who got a Moderna vaccine, 18 or older, can get a booster 6 months after their initial series. And anyone who got the J&J vaccine, 18 or older, can get a booster 2 months or more after your initial series. We've got some mix and match questions. I wanted to highlight that teens, 16 and 17-year-olds, can only get a Pfizer booster. Children, actually, under 18, can only get Pfizer vaccines. That's the one that's been approved. And actually, the original approval for Pfizer was for 16 and up. That's why some of you were wondering why just 16 and 17, not 12 to 15. It's because there's been long data to understand the durability of that vaccine protection. And adults 18 and older can choose among any of the COVID vaccines as a booster dose. What I have been recommending generally, where we look at the data, is that if there was a very particular reason you chose one vaccine, I would stick with that same vaccine. And so I have some patients, I continue to see patients in clinic, and where I see people and they say, I had Johnson & Johnson for X reason, it's the one I feel comfortable with, I say, great. Get a Johnson & Johnson booster then. But otherwise, we do recommend, based on the data where there have been comparisons, that if Johnson & Johnson was the first vaccine, I would recommend that booster dose be either a Pfizer or Moderna. I don't think there's a big difference. But for the other folks, the data was not particularly different for any of them. So some of you were asking, for example, who was this? Someone was asking, Donna Tritz said, I'm pretty sure the CDC recommends getting the opposite one from the original for the booster. Actually, no. CDC recommends getting a booster on that time frame and says it's possible to mix or match. I got Pfizer as my first doses. I stick with Pfizer for my booster. That's broadly what I recommend. People who got Moderna as their first doses, I would generally recommend that you stick with Moderna. And people with J&J are the only ones who I would recommend the shift to either a Pfizer or Moderna if all else is equal. But the most important thing is you get a booster, and that's by far more critical than the specific one. So thanks for everybody with booster questions, and I hope that clears it up. Our vaccination rates continue to increase. We got a question about sort of 5+ versus 12+. So what this shows on the dashboard is what percentage of everybody in the city who is 5 and up has been vaccinated. So for example, on the left here, where we see the at least one dose, 74.6%, almost 75% of everybody 5 and older in Chicago has had a first dose. That does not mean that the 5 to 11-year-olds are 75% vaccinated. So just to clarify that. In contrast, if you click and look by age, all of this is straight off the dashboard, so you can explore this. We're making very good progress. We're up to 29% of our 5 to 11-year-olds having had the first dose, and 18% fully vaccinated. But you can see that group is by far still less vaccinated than the other groups, and that's where a lot of our focus has been. I do want to point out our 12 to 17-year-olds have crossed that 70% mark for the first dose, which I'm pleased about, but there are neighborhoods where that is very much not true, and we are focusing on that. And then just one last thing to call out is those 80+. Steve, your comment about nobody under the age of dying isn't actually accurate, but your note that people over 80 are at highest risk is absolutely true, and I thank you for raising it, because people who are older and have underlying conditions are by far the most likely to die. And my largest concern is are those stats for our people over 70 and over 80. It is unusual that people in their 50s are the most likely to be vaccinated in Chicago. Across the country, it's people in their 70s and 80s and 90s. So if you know anybody who is older, please, in advance of Omicron surge, with Delta surge, there are, I want to see the kids bars move up, but I want to see those older Chicagoan bars get even more protected, more than I want anything in terms of vaccination movement. Also, we had some follow-up questions about pediatric vaccine availability, and I thought I would just share that there is a lot of pediatric vaccine available. We've already received, distributed, and delivered 264,400 pediatric doses of vaccine for those 5 to 11-year-olds. That is more than enough for what is needed. And we have 205 sites now in Chicago that are active pediatric sites where we have shipped vaccine. They are vaccinating, and we've processed 570 orders, meaning some of those sites have gone through their first allocation. We've gotten them more. I just put up here, just so you have a sense of some of what happens behind the scenes, where we're working with the federal government. We're tracking how much is coming into the jurisdiction, meaning to the Chicago Department of Public Health, that we are then distributing to clinics and pediatrics and urgent cares and our own sites, our at-home, and then how many are coming in through pharmacies. We monitor this closely. If we actually requested and received additional boosters for Maternal last week above our allocation because we saw good uptake there. We are tracking this carefully and closely. There is pediatric vaccine available. There are boosters available. You have any trouble with that, reach out to CDPH. And then some additional questions just about the family vaccination clinics at city colleges. So as you know, every Saturday and Sunday, CDPH has been standing up big clinics at city colleges. City colleges has been an amazing partner to us throughout COVID. And so this Saturday will be at Truman College. This Sunday will be at Malcolm X College. It's 9 to 2. Walk-ins are welcome, but we do highly encourage registration just to make sure we've got enough vaccine to help try to cut down on lines. We got a question, are boosters available? Yes, they are. And we are not doing family vaccine clinics the next 2 weekends due to holidays, and that's been planned all along. But pharmacies, clinics, FQHCs, hospitals, urgent cares, and more have vaccine. And our ongoing standing CDPH immunization clinics remain open and are vaccinating. At home, as you've heard me say, is going very well. Call to schedule, 312-746-4835. As I mentioned on Tuesday, we never schedule people in the 4 to 5 days right after they call. So if you're calling, it's likely that you would be scheduled more for a week or two from now, just because of some of the logistics of clarifying. But if you're looking for boosters and you've got somebody looking for a primary, you just need one appointment. And then in follow-up, we love vaccinating 10 people in a home. There are not the incentives available. The monetary sort of incentives don't come for boosters, but they do for all primary doses. And then just in summary, as always, need a vaccine or a booster? Have any questions? Call us 7 days a week or go to that website. We will get whatever your problem is sorted. So Jen, if you don't mind, I'm going to hand to you just to do a quick overview of some of the maternal, infant, child, and adolescent health work, and then we will turn in directly to your questions.
Great, thank you. And great to hear about all that progress we're making with vaccination for children. We're going to come back to the importance of vaccination for pregnant people or people who anticipate getting pregnant. So just quickly, high level, in the MICAH Bureau, Maternal, Infant, Child, and Adolescent Health, the programming that we're engaged in at CDPH, well, it falls largely into 4 big buckets. We have our WIC program. We are the largest provider of those services in Chicago, reaching about 24,000 people.
And what's WIC?
In a year. WIC is a federal program, actually, that is the Special Supplemental Nutrition Program. It serves women, infant, and children, so pregnant people, people with newborns, and children up to 5 years old, and gives them access to healthy foods, important education about nutrition, support for breastfeeding, does additional health screenings, and gets families connected to other additional services they might need. It's a really important program. There's lots of strong evidence that it reduces the risk of prematurity and low birth weight and infant death, and has longer-term benefits around reducing obesity and addressing food insecurity. So WIC's been open. We've been open for business throughout COVID.
We sure have, all over the city.
Yep. And our team's done an amazing job of continuing to serve people and even moving forward in modernizing the program. And we now have electronic benefit cards where you can get your WIC benefits loaded onto those cards. You can shop wherever you want to, buy what you need. And that goes a long way to really addressing some equity issues around food access for families. I'll come back to what we're doing in the nursing and support services program, but I'll jump to our school-based health services. So we have a long-standing partnership with the Chicago Public Schools that we're very proud of to address the range of health issues for school-age kids. We focus on delivery of school-based programs, 3 programs, a vision program where we're providing comprehensive eye exams and free eyeglasses to children, tens of thousands of them in a year. We have an oral health program, a dental program, where we go into schools, many of you may be familiar with this program, and do comprehensive exams and cleanings and place sealants on children's teeth. And during the decade that we've been doing this work, we've served more than 1 million kids. And then we've got our CHAP program, which does sex health education, particularly around gonorrhea and chlamydia and birth control. We know that gonorrhea and chlamydia are highest in young adults and adolescents, so it's really important to get this education to high school aged students. So there's great education, and then there's optional testing and follow-up care for kids who test positive and elect to get that linkage to care. And then our final large program area is our lead poisoning prevention and healthy homes program. We know that the greatest danger to children from lead comes from paint. The good news is that we've made incredible progress and have really significantly reduced the rates of children who experience lead poisoning, but there's still much more that we can do. In this program, we're following the testing carefully, where we're seeing reported elevated blood levels of lead. We do the follow-up with families. We send nurses to talk to families, make sure that they understand all the developmental and medical implications of poisoning, get them connected to services, and make sure that we're doing everything we can to help those kids recover. And then we'll also follow up with families that are eligible and get those lead hazards removed from their home and address other health issues that exist in homes.
Yeah, and I'll add one thing to this. This is a program that tends not to get as much attention, but every single time a child, this is young children generally, get a lead test at the pediatricians at their regular pediatric visits, their healthy child check at age 1, for example, age 2, age 3. The health department receives all of those results, and wherever we are seeing an elevated blood lead level, our inspectors are going in, figuring out what is happening, and then working to make sure we can address that. And it's an example of flying under the radar, but we've made amazing progress in this city, although there's still work to do.
Yeah, and we're actually poised to, go really big in addressing this problem. It's completely preventable. And so the city's making an additional investment of funding to expand our ability to abate lead hazards in home and address those other health hazards in homes. And the White House announced today a new comprehensive action plan to address lead hazards from water in pipes, as well as lead paint. So there will be additional resources coming to the city of Chicago, and we're excited about the progress that we'll make in reducing this hazard. Great, so I'm going to jump to a program that's really become the area of a lot of focus for us, and we're quite excited to be standing up. This is something we've been piloting, but we'll talk some more about how we're going to bring it to the entire city of Chicago. We know that welcoming a newborn is a time of joy and also can be a time of real stress. And there's lots of attention really paid to the health of everyone during a pregnancy, especially if you're getting prenatal care, and we hope you are getting regular routine prenatal care. And there may be lots of support and attention that you get in maybe that week following bringing baby home. And lots of information shared in the hospital. All of that can be kind of overwhelming, and too often it's a little short-lived. And so that we know after a couple of weeks, some of that additional attention and support can fall off. And that becomes a very vulnerable time for families. And we know that 94% of families express some need for additional support during that period of time. It's also when we know that there can be the onset of things like postpartum depression and some other health concerns that emerge. And just generally speaking, during that postpartum period, we do see some troubling outcomes in terms of infant and maternal mortality and severe disease. We also know that in a city like Chicago, we have a big array of supports for families, but that it can be really hard to figure out what they are and to access them and to navigate them. So this program, Family Connect Chicago, is designed to address those needs. And it starts with a visit from a nurse at about 3 weeks after delivery of a baby. The awareness of that visit starts usually during a hospital stay or with prenatal care. We do outreach, we schedule, and then a nurse visits for families who are interested in taking advantage of this within 3 to 5 weeks after delivery of a baby. This is a comprehensive visit where we take lots of time to understand the family's needs, to understand the health of mom or birthing person and the baby, and then to identify the additional longer-term supports, resources, and services that families need, and to get them connected to those supports and services. But beyond the visit, it's really more than a visit. Family Connects is all about building this system, this comprehensive system of community support. And so the data that we collect from these visits, which is of course an individual family's data, is kept private and protected, but it's compiled and we use it to better understand what the needs of families are across community areas and across the city, how well we're doing in providing the services that are needed for those issues, how well families are able to access those services, and where the gaps might exist. And that data is then shared with what we call a system of community alignment. In Chicago, that is 6 regions of the city where we have community alignment boards in place that consist of people with lived experience, healthcare providers, a whole range of social and human service providers, like folks who are doing housing security and food insecurity and workforce support, intensive home visiting, education providers, early childhood education and care, and many more. And they do the work of reviewing that data and doing the problem solving to fill the gaps where we see gaps exist, all in the interest of creating a stronger system. So as I mentioned, we've been piloting this program for the last couple of years. In our pilot, we've got 4 hospitals: Humboldt Park Health, Rush, Sinai Chicago, and U Chicago Medicine. And we've been offering the service to families delivering at those hospitals. We've also, in our regional alignment structure, brought 3 of our regions on board. The work that's happening with those regional boards is led by delegate agencies who are partnering with us. We have a citywide advisory council board, a team from UIC conducting an evaluation of our program, and lots of technical assistance from Family Connects International. And doing all of this to learn as much as we possibly can about how we can take this to scale citywide. And so seeing the promise of this program and the needs really of families that were so exposed by COVID, we want to ensure that we have that service and system of support in place across Chicago. So we're getting additional funding thanks to Mayor Lightfoot and the Chicago City Council in the form of American Rescue Plan funds for the next 3 years to begin to take this program to all 16 hospitals, to build out our community alignment structure in all 6 regions of the city of Chicago, with the aim of ultimately offering this service to all 32,000 families welcoming newborns in Chicago.
All right, and that's so about 32,000 new babies a year in Chicago?
Yep.
That's a lot of home visits. That's great. All right, so thank you so much for that overview. We're going to turn to your questions, but not unexpectedly, people are asking about COVID and pregnancy, and we were expecting that. So I wanted to just give you a few links that you can go if you want to know about COVID in pregnancy. So to be super clear, CDPH strongly recommends COVID-19 vaccination for people who are pregnant. Full stop. Pregnant people should also receive a COVID-19 vaccine booster shot. My own cousin recently gave birth, got vaccinated, got a booster during pregnancy. We've got multiple pregnant people on the COVID response team at CDPH. They are all fully vaccinated, strongly recommend. COVID vaccination also recommended for people who are breastfeeding. There have been reports that show that people who are breastfeeding, there are some antibodies, some of that protection against COVID in breast milk that can help protect babies. There's still more data that's needed in that in terms of understanding what that level of protection is, but it is safe and it can absolutely help protect the baby. And also, very clearly, COVID-19 vaccination recommended for people trying to get pregnant now or might become pregnant in the future, as well as their partners. And there's some links there from CDC if you want to see evidence. We're not the only ones who say this. This is the list of all of the groups that have signed on to the statement, whether this is the American College of Obstetricians and Gynecologists, that's the OBs that help pregnant people give birth, the family practitioners, the pediatrics, you can see the list goes on and on and on there. All of them together have said, as the leading organizations representing experts in maternal care and public health professionals that advocate and educate about vaccination, we strongly urge all pregnant individuals, along with recently pregnant, planning to become pregnant, lactating, which means breastfeeding, and other eligible individuals to be vaccinated against COVID-19. There's a link if you want to explore, but the evidence on this is clear and strong. There are a lot of risks, this is why, of symptomatic COVID in pregnancy. We know that pregnant women are significantly more likely than non-pregnant women, if they get diagnosed with COVID, to be admitted to an ICU, to need to go on a ventilator, or to die. They also, we know, are at higher risk for preeclampsia and eclampsia, which are they're problems that can happen when people are pregnant that puts both the mom and the baby at risk. They are also at higher risk for preterm delivery, meaning giving birth sooner than is ideal for the health of the baby, and for other neonatal complications. There are specific links there to some of these large studies, but I want to be clear over and over and over again, we worry a lot about people who are pregnant, unvaccinated, because if they get COVID, many of them get sick. And then the benefits of COVID in pregnancy, COVID vaccination, in pregnancy, is that vaccination is highly protective against severe disease and hospitalization, including the Delta variant. Receiving the vaccine, even during pregnancy, it reduces that risk for infection. It reduces the risk for severe outcomes in pregnancy. One of the reasons that a lot of people in my life who have been pregnant have decided is that it also, some of those antibodies, that protection can be passed to the fetus. We see this for influenza too. It's part of why we encourage people to get vaccinated against flu if they're pregnant, because children under 6 months can't get a vaccine. Their immune systems are still developing. And so especially if you're going to be giving birth in that first 6 months, if we're in a COVID surge, it's really important to try to protect that baby as much as you can. And then it also protects, obviously, your other children, family members, and your community. So let's get to your questions. All right. Let me just get over there. All right, so right off the top, okay, so some questions about, you mentioned that you work with CPS, and most of this was about the work that we do pre-COVID, but there are people wondering about some of the COVID CPS work. So I will sort of start off with this, and then if you want to chime in about some of the additional pieces, we can. So we got Dr. Shaw, for example, on Twitter saying, how do you recommend that CPS handle the post-holiday surge when children return to school in January? We've got Crystal Crosby on Facebook wondering why isn't more testing happening, and some others, but let's start with those. So first of all, in case folks missed it, CPS is actually doing a large testing kit distribution around the holiday break. This is the last week that CPS is in school, and they'll be distributing about 150,000 take-home COVID tests ahead of winter break. Those will be tests that kids will be taking home, and they used data to make sure that every school that is in a high COVID vulnerability area in Chicago, and then most of the elementary schools and others in medium vulnerability areas, for example, are prioritized here. These tests will be at home. Parents and guardians will have the opportunity to collect the sample at home and then really drop it in the mail, drop it in FedEx. And the ask is for folks to do this the Tuesday the 28th. So it's after perhaps the earlier part of that holiday break and gathering, but with enough time to have those results back and have had quite a lot of testing to try to limit that risk when we know kids are at higher risk when they're actually out of school and gathering. It's not the whole thing, but it is a big effort. 150,000 all at once is a lot of testing. So this is an example of some of what CPS is doing. Our private parochial charter schools there are other things that they are all doing, but it is going to be important with the return back to school. I expect us to very much still be in a surge. I think Omicron may start to be more of an issue by January, and vaccination remains the most important thing, even above testing. So pushing vaccination for everybody over age 5 is the top priority, and CPS and others encouraging people, yes, we're working on this testing, that's another piece, but boy, where we can get, when we've got some schools that are very highly vaccinated and not seeing a lot of COVID at all in those settings, and that's really where we want to be. Okay, anything you want to add sort of about the CPS interaction or anything else with that?
Just that we continue to partner really closely with them to understand their data and to support them in terms of the decisions that they're making about testing and all the safety practices happening in classrooms. And it's a strong partnership, and we're confident that we're making good progress.
Yep. All right, good. So Margarita Knox on Facebook is saying, will there be an option to go remote to avoid COVID exposures once the children have to return to school? I certainly am hoping that we do not need to be in a place where there is a need to go remote. We continue to be in close conversations with all of our school partners. This is obviously a big conversation nationally, and there have been and continue to be a lot of disparate effects on families that have moved to that remote learning. So certainly we expect to see some more cases in school, just like we're seeing, and we'll be doubling down on protections within schools, and there may be individual schools that may need to happen. But I am hopeful and actually confident that won't need to be a citywide decision. We'll see. We're going to have to see what happens with Omicron, but I do not expect that there will be that we will be making plans to sort of move entirely remotely, and certainly not for extended periods even if that were a thing. But really, we think about risk at the school, and again, I've said this 100 times, but it bears repeating. We have seen in the data that actually when kids are in school, the risk of COVID is lower than when they are not, just in terms of the activities and interactions that they are often having outside. And we just got to get people vaccinated, like honestly. Okay, so question for you. Someone here is wondering, how do they get a home visit? Like, there's a daughter who's going to be giving birth in Chicago, and can they get them into this program?
Yeah, so right now, as I mentioned, we're piloting with 4 hospitals, Rush University Medical Center, University of Chicago, Humboldt Park Health, and Sinai. And so if your daughter is delivering at any of those hospitals, they will be contacted either by hospital staff and by CDPH with an offer of a visit, and that's usually happening within, if not at the hospital, within days of discharge. So there will be outreach to those families. And then in terms of the rest of the hospitals, there are 16 birthing hospitals in the city of Chicago. That's the work we're doing over the next 3 years, is to bring all those hospitals into this program so that any Chicago family delivering at those hospitals, and eventually any Chicago family delivering like just over the border in the suburbs, that we'll be able to identify those families, reach out, and offer them a visit. So stay tuned.
All right, comment here on Twitter. Somebody doesn't think it is a good idea for any kind of home visiting at this time, given where COVID is. And there's some other comments about masks. Do you want to sort of address that? Because this is a conversation. This is absolutely the kind of conversation, not just us, but all sort of health providers are having right now about what we can do to make sure people can continue to get care and get services, but do things that are required. So I think that's a good question. Can you address?
It's a great question. And it's certainly COVID has had an impact even on how we've rolled out this program. And there are many other home visiting programs, more intensive, longer term ones. And I'd say that the community of practitioners in this space has been staying in touch with each other a lot, following the data. In the early days before a vaccination, everything went virtual or stopped. So we were offering virtual visits for a long time. Once we were able to actually get our nurses vaccinated and started to see more vaccination in the population, just understood more about how the disease would spread, we were able to bring back online an in-home visit for families that want to have one. And of course, we follow all the safety protocols. So we're screening before we do a visit. If anyone has symptoms and there's any concern, then we take that visit virtual. And then our nurses, as I mentioned, are vaccinated, so they're protecting families from exposure, and then using safety protocols when they're in the home.
And can I just ask, are you talking about COVID vaccination sort of with families as you're in? Like, just curious about that. That was my question actually.
Yeah, absolutely. And honestly, we're a little concerned because we are doing this screening when we're scheduling with families, and hearing from a lot of families that the birthing person is not vaccinated, and then other members in the household as well. So that's really an opportunity for us to share the information like you shared, and help people understand why it's so important to get vaccinated, and then get them connected to the range of ways that we can make that happen.
A family that has a newborn is a very good candidate for at-home vaccination, for example, and kind of getting everybody done. Okay, thanks. Man, some of you guys have funny names. Pissed Off Taxpayer on Twitter says, why is it that I'm not vaccinated and yet I've been around vaccinated people who got COVID and I did not? Why is it that when I go to my doctor, masks are not required? So two different questions there. So I am actually interested if you are going to a doctor's office where they are not requiring masking, because that is not at all my experience. That is not at all when we are talking to providers, their experience. Let me tell you, doctors' offices are among the most concerned when it comes to this COVID surge. And reminder, masks are required in indoor locations. So I'm not sure if you're talking about maybe you go to a family practice office and there are children under 2 where a mask is not required. But if, I am in a clinic every single week and we are very serious about masking for staff, for anybody who's coming in, screening, all of that. So you can report to 311 if there is if you're going to a doctor's office and not seeing that, because we would do some follow-up, honestly, there. And I'm just being honest with you, healthcare workers are tired. They are tired and they are worried about COVID, and they are trying to do what they can as they are seeing more and more COVID patients come in, to keep the other people in the office and their own staff as safe as possible. And then to the other part of your question, which I'm not sure. Okay, I'll try to remember it. To the other part of your question, I lost it in the scroll there. I think you were asking, you said you were not vaccinated and you were wondering why had you not gotten COVID where some other vaccinated people had. So, if we could 100% predict all the time in a gathering how vaccines, prior infection, the amount of exposure that you have had could lead to whether or not somebody would get COVID, that would be amazing. That's just not possible. I don't know the gatherings you're at. A lot of it has to do with how much of the viral particles you're actually ingesting. So if you're at a gathering and it turns out the person who had COVID, you know, was sitting at the head of the table and you were more than 6 feet away at all points, you are at less risk, and somebody, even if they're vaccinated, if they're not boosted, it's been a while, they have underlying conditions, et cetera, they're sitting closer, they're probably at higher risk. But I am concerned that you're at gatherings unvaccinated. Is it possible you had COVID in the past and you have some level of those natural antibodies protection? It's possible, but I worry that you know, it's probably a matter of time, honestly, in the surge that we're seeing, if assuming you live in Chicago, until you do get COVID, frankly, if you're not vaccinated, especially with Omicron coming. And I just worry about people who are still taking their chances. I hope you're young and healthy, and the chances would then be good that you would not have a severe outcome. But we have people with long COVID, and we have people who were young and healthy now in the hospital. And I've seen that very personally, and I know a lot of you have too. So thanks for the question, and I would encourage you to do what you can to protect yourself. Okay, question or comment maybe. So you're the person who is in charge of maternal, infant, and child health. Why is the city trying to take away chocolate milk? Do you know what this is in reference to? Because I do.
I don't.
Okay. Yesterday, yesterday, City Council passed an ordinance that was about the default beverages that get served with kids' meals in the city of Chicago. And that is actually just putting it, all it was doing was there's a state law that was passed around this, and we are just implementing the state law. So this was not something specific to Chicago. It does not take away chocolate milk. Let me be very clear about that. But it says that the drinks in, you know, Happy Meals and their equivalent, the default should be drinks that meet particular sort of fat and calorie standards. So the default should not be soda, for example, in a kid's meal. The default is, you know, needs to meet some of those requirements. But it in no way takes away, also parents are able to ask for soda, for example, if that's what they want, but the default needs to be the healthier option. So we did not outlaw chocolate milk in the city of Chicago, and this is something that's being done across the state and across the nation. Intake of sugary drinks are known to be a big risk factor for obesity in children, and obesity in children is a risk factor for obesity in teens, and obesity in teens is a risk factor for obesity in adults. And some of the work, and this, by the way, this was done in conjunction with industry, to be clear, really negotiating what should this look like, what's feasible, and so that's what that was about. And I hope that helps clarify where we are. All right, we are actually sort of coming on time already, which is hard to believe. Let me kind of try to get a couple of these in real quick. I think I took a Dr. Shaw already, but he's back on Twitter here saying, what are you doing to ensure that Chicagoans have access to free rapid result home tests? Not on-site tests, but home tests. So few things. So for example, I actually gave that example where CPS and many of our other schools are making at-home tests available around winter break. But in addition, the Chicago Department of Public Health has been working hard to acquire these. At the federal level, they're working on the supply of these. You saw, for example, there was an announcement that these home tests will now all be covered by insurance. You were able to previously use your health savings account. You know, they're about $12 a test, give or take, but that is prohibitive for folks. Insurance will be covering those, which is good. But also, we know there are a lot of people who aren't insured. uninsured. We know there are a lot of people who aren't connected. And so we have been distributing thousands and thousands of these in our highest need areas in Chicago. When we're doing the door-to-door knocking, whenever we're working on sort of outbreak scenarios, we distributed them to every alderman who wanted them in advance of the Thanksgiving break so that they could have them available and distribute them out of their offices to their communities that had need. Certainly it is something that we are interested in continuing to build access to. And you know, these are the tests, and we've got a few follow-ups. These are the tests that are available through, you know, online pharmacies. You can buy them over the counter. A couple people are writing saying, are these tests actually any good? Here's how I think of these tests. The reason the at-home tests are good, these are antigen tests, meaning they work kind of like a pregnancy test. They're not looking for a PCR test is actually looking to detect sort of the genetic material of the virus. The antigen test is looking for the protein. And it is not quite as what we call sensitive, meaning that a PCR test is more likely, a little more likely to be positive than an antigen test, okay, than the home test. However, I actually like the at-home test for public health purposes in a lot of ways more than I like the PCR test. Because if you have COVID at a level that you might be spreading it, capable of spreading it, that antigen test is generally going to be positive. Right. And you can take that test literally 10 minutes before the interaction you're going to have. So where I'm thinking about holiday gatherings, where I'm thinking about if you're going to go and, you know, be in contact with someone who is older or immunocompromised, or you're worried, first and foremost, I hope you're vaccinated and boosted. But regardless, the ability to take a test right before that, where everybody who's gathering can do, you know, at home or on the spot test and have that result. If everybody is negative, the chance that anyone is going to be spreading COVID, even if you have a couple of people who are possibly in that very early stage, is really good. And the thing with PCR is it takes longer. It takes a day, or sometimes even a couple of days to come back. And so I like the at-home tests a lot. I keep them at home. If I have a little bit of a symptom, if I'm at all worried, if I'm gathering, you know, I encourage folks to use those. If there are more concerns or we're needing to do follow-up testing, yes, you can go get a formal test and a PCR test. But I think they're going to be really important and increasingly so for at home. Agreed.
Having that additional peace of mind will just bring more joy to the holidays, and I think we could all use more joy.
Absolutely. Absolutely. Let's give you one more question to you, if you don't mind. Okay. Question here about what actually happens during a home visit. On Twitter here, just raising that families with newborns might be concerned about, you know, quote, the government coming in or assessing. You know, not everybody's house is maybe that clean when they have a newborn for those few days. And can you just talk a little bit, just quickly, because I do think that's a really good question. I know we're almost at time, but what actually happens?
Yes, and just to address the government coming into your home, I mean, the aim really is to normalize this so that everybody's getting one of these visits. It's not because you've been pegged ahead of time as being at high risk or something like that, but that it's just part of the way we care for all families bringing a newborn into their house. Those are usually 2-hour visits. It's really a conversation. Yeah. It's quite amazing. There's a protocol that runs through a bunch of validated assessments, and we're checking on the health of the mom or birthing person, and checking for some of those risks like high blood pressure, also talking about family planning, ensuring that they're recovering well from postpartum, because often they're not going to see a doctor again until 6 months after 6 weeks after they've had the baby. We check on the infant's health and ensuring the baby's thriving. There's lots of support and coaching and reassurance around diapering and feeding and support for breastfeeding. And then there's conversations about healthcare plans. We want to make sure that families continue to be connected to healthcare. Pediatricians, OBGYNs for follow-up, family medicine, and that appointments that are supposed to be happening after a baby is born are happening. And if a family's had a loss of a baby, there's also support there around grieving and other recovery related to health. Many other things happen. We're exploring the safety of the home. We're exploring childcare plans.
Things like making sure people have a crib, making sure people have car seats, that kind of thing?
Oh, absolutely. I mean, we probably more than anything, we're making sure and supporting families that need help with getting additional food and diapers.
Yeah.
Diapers are wildly expensive.
Yep.
Everybody needs them, and folks should not have the stress of worrying about whether they have enough diapers for their kids. So we are investigating substance use, potential personal violence in the home, and really taking a look overall at the well-being of the family, and then accessing a whole range of services and supports for families based on not only what we see their risks are and their needs are, but what their desires are. So there can be visits that result in a trip to the emergency room, and then there are visits that might be like, here's where you can go to read to your baby sessions at your local library.
Yeah, great.
And everything in between.
Great, and I'll just add to that, this sort of government thing. The most trusted, where you look at the data on sort of the most trusted professions in our society, it is nurses, actually,
yes.
right?
Yes.
And these are nurses. These are nurses, they may be public health nurses that work for CDPH. They could be nurses that work for some of the hospitals that are coming onto this program. But this is really, it is about care, it is about support. It is not punitive in any way. It is not, it is the reason it's called Family Connects is it's about connecting families. And so I appreciate someone asking that, because I do think it's, having people understand sort of the goal is important. Yeah. All right, we are just about at time. I'm going to take one last question here from, I saw something about, oh dear, sorry. Yeah, Gilead Chicago on Twitter says, because of the infection rates, is it time to start changing plans around in-person gatherings, even for vaccinated folks? And I think this is just a good place to end, because I know people are having a lot of gatherings right now. I strongly remain in support of gatherings for holidays, end of the year, et cetera. I get a lot of these comments, why can't we live with COVID? We are living with COVID. We have to live with COVID. But I do want you to be careful. For me, that means making sure everybody at gatherings is vaccinated and boosted as much as they can for age. And then if it's going to be a big gathering, if people are going to have masks, if there are people you're not quite sure of, potentially adding some of those rapid tests that I was just talking about can help add to that safety. So I can't make your decision for you. The CDPH has not advised against gathering. I want to be very clear about that, because I think there's some people sometimes are saying we're trying to cancel Christmas. We are not. I want you to gather, but I want you to do that safely, and I want you to know that the risk is higher. The last thing is, anybody who's got symptoms, please don't gather. Take a test, be careful. There is increased COVID. So I wish you a happy, safe holiday. We will continue to be on next week, but I know planning is in advance of that. Again, this is Jennifer Vitus, Chief Program Officer at the Chicago Department of Public Health, leads a big team of super committed people who work behind the scenes at protecting maternal, infant, child, and adolescent health. So thanks again for joining. Thanks for your questions. Any last comment?
Just thanks for the opportunity to be here and share more about our work. And just, if you are thinking about becoming pregnant, or you are pregnant, or you've just had a baby and you aren't vaccinated or boosted, please go do that.
Couldn't have said it better myself. Thank you, everybody. See you next week.